Let's compare FUE, follicular unit extraction, to FUT, follicular unit transplant. I made a video on each of these procedures you all can see if you want to go into the detail of each one. But let's look at pros and cons. With FUE means you take out each follicle individually and you move it to a part of the scalp where you have less hair or no hair. With FUT, you take out a strip of scalp, you take that strip, you cut it up into individual pieces off the field or not on the patient, and you take individual follicles out of that strip. So you're ending up with the same thing. You end up with follicles. With one technique, you take them individually. With the other technique, you take a piece of scalp out that you suture the ends together so there's little mark left that you took anything, and you take out the follicles from that. Then you make little holes in the front and you move the scalp hair to where you want it, and you're moving follicles. Remember, each follicle will have 1 to 6 hair. Now, what are the pros and cons? And I'll tell you what people are thinking, and I'll tell you my approach. So with FUT, when you take that strip out, the belief is you damage less hair because you're making 2 incisions, you're suturing the scalp together, and you're not causing any damage to surrounding hair, so you have the potential of doing more transplants down the road. Now, when you do FUE, or follicular unit extraction, you're drilling individual follicles out. So the thought is you're thinning the scalp even more from where you're harvesting from, and you might be limited in how many harvests you can do because with each drill you're taking off follicles. But when you're doing that with each little punch, each little hole, you can damage surrounding follicles. So you may be limited down the road. Now with FUT, or strip technique, you can end up with a scar. Now when I do the technique, I do a trichophytic closure. Or what that means is I overlap the hair follicles into the incision, so they go through the incision so you can't see it. But even in the best circumstances, sometimes you can see a thin scar if someone gets their hair really short. Now if someone's never going to wear their hair short, you're not going to see that scar. With FUE, there's no mark left that you took anything. However, sometimes you can get this moth-eaten-like appearance where you get little thin patches or bald areas behind your scalp from taking out too many grafts in one region. So FUE does work really well most of the time, but there can be some hiccups with it, right? So when you do these procedures, you got to figure out what's best for that patient, what's going to give them the best result, what are the pros and cons, and then you make a plan. FUT, less costly, quicker procedure, potential maybe for more transplants, less potential injury to the scalp, but you have that potential of that scar. With FUE, you take out each follicle individually, so there could be more damage to surrounding follicles. The scalp could end up a little bit thin in the back. You could get that moth-eaten-like look where you have little bald patches. And it takes longer and costs more. So you look at the pros and cons of each procedure, and then you figure out what's going to be best for my patient. For me, it's so important when I meet a patient not to take them and throw them into a procedure. To get the best results, what you have to do is you have to find a procedure that fits that patient. And I can tell you this, although procedures are very standard, every time I do a case, every time I do a transplant, it's a little bit different for each person. The technique is a little bit modified, the graft placement is a little bit modified, the recipient sites are modified. Everything has to be unique and custom because no 2 people are the same. And that's how you get a wild success.